Good day to everyone. My name is Jonathan Wolfe, Alfred Landecker Professor of Values and Public Policy at the Blavatnik School of Government and Fellow of Wolfson College. May I welcome you to the second in the school's new series of webinars. Today's event on the coronavirus and minority rights is part of the Alfred Landecker program here at the school, funded by the Alfred Landecker Foundation. Alfred Landecker was a German Jewish accountant, husband and father who was deported from Mannheim in 1942 and murdered in the Holocaust by the Nazis. The foundation, named in his memory, aims to support free democracies, to protect minority rights, and to combat anti-Semitism. The topic of this webinar is the coronavirus pandemic and how, around the world, there are troubling examples of members of minority groups being subjected to additional pressure during the crisis. Some groups, for example, have been demonized as supposed vectors of disease. Governments have used emergency powers in ways that may disadvantage minorities and advance populist and nationalist agendas. Pre-existing division and discrimination have, in some cases, been deepened. To explore these issues and many others, I'm joined by three of my wonderful colleagues from the school. Maya Tudor, Associate Professor of Government and Public Policy and Fellow of St. Hilda's College. Federica D'Alessandra. Federica is Executive Director of the Oxford Programme on International Peace and Security and the Institute for Ethics, Law and Armed Conflict, known as ELAC. And Dapo Akandi, Professor of Public International Law at the school and also co-director of ELAC and a Fellow of Exeter College, Oxford. Each panelist will speak for around 10 minutes and then we'll move to a Q&A. So you can ask questions in the Q&A you see on your screen. As there are so many people here, it's not possible to catch anyone's eye. We're not seeing your video. So could you please put any questions into the Q&A? We'll try to group them together and ask them on your behalf. So let me begin by introducing Maya Tudor. Maya is going to talk about political questions concerning authoritarianism and minority rights. Maya, over to you.
Thank you, Joe. And thank you to all of you for joining us from all around the world. I thought I would just jump in by making some general comments, as Joe said, about the kinds of politics we're seeing in the wake of the pandemic, and then making some specific comments through the lens of the panel's theme, in particular, how minorities are affected. So the first general observation I wanted to make is that in spite of kind of a fashionable narrative that authoritarian governments have been perhaps more effective or capacious at handling pandemics, that researchers from very different contexts have shown that there is absolutely no justification for this. There's no correlation between regime type and effectiveness of response. If you look at the various ways in which we measure how effective countries have been at the pandemic response. So China was probably an effective responder. So too was Taiwan, South Korea, Japan, Germany. Those were all democracies. There are authoritarian regimes that have handled it well and poorly, Singapore and Iran, democratic regimes that have handled it well and poorly, Germany and the United States. So just again, to make that general point, because I think it bears some repeating in light of some of the news stories out there. The second point I wanted to make is that citizen trust and state capacity are the two things that researchers are honing in on as having mattered for effective pandemic responses. So I want to caution that we don't yet really know how effective countries have been, in part because countries are counting deaths and things like this very differently. But researchers, I think, are beginning to hypothesize why this is. They are finding some relationships between world trust as measured by things such as world value surveys and effective responses. the reason this might be true is that, trust acts like a social glue, and it allows governments to take decisions quickly. Those decisions are often respected and followed by citizens, and citizens, of course, trust that when appropriate, those measures will be withdrawn. Similarly, countries that have had state capacity to deal with the pandemic, particularly states that had SARS experience, were countries that did particularly well at responding quickly in ways that we now know are sort of the golden standard of test, trace, and isolate early cases. But they also notably had invested in the personnel, the hospital bed capacity, and the institutions. And then the final kind of general point I want to make is that the pandemic has generally heightened scrutiny of government decisions, but it has also, in many ways, silenced political forces that have been critical of the role and the size of government itself. Governments around the world have done what the private sector simply could not and would not have done. And it's notable that in contradistinction to just a few months ago, no one is seriously suggesting that less government here is better government. It's notable that among Western democracies, the US is held up as one of the most deeply polarized. And according to recent Pew Research, 9 in 10 Americans say that the economic aid package, which was passed in March, was the right thing to do, including notably identical majorities of Republicans and Democrats. And I think that's quite striking. In a related note or vein, we saw, of course, the rise of populist and nationalist governments that were had enough of experts, and that stands in contradistinction to, I think, what we're seeing now, where many governments, notably the UK government, follows a kind of mantra of being guided by the experts. So those were my general comments, and I think minorities, as we know, and across the world in almost all contexts, have been particularly affected by the politics of the coronavirus. And at a basic level, and I know that Federica is going to speak more about this, but the pandemic has mirrored social inequality, economic, environmental, and occupational risk factors that we know were already there have translated into higher deaths among disadvantaged minorities in almost every country that I've looked at. It's partly because in some cases, disadvantaged groups have less access to healthcare. That's particularly the case in the US. It's partly because racial and ethnic minorities tend to be overrepresented in jobs where there's precarious employment and where going out to work is a matter of life and death, or of eating or not. And it's partly because they have other situations, such as housing situations, that tended to be crowded and therefore make it difficult to follow best practices. Second point as relates to kind of minorities is that the pandemic has provided, as Joe already mentioned, an expedient to governments that were already bent on consolidating executive power and reining in the mechanisms of democratic accountability. We've seen this in Kazakhstan, in Israel. Netanyahu has used the coronavirus as a reason to delay a corruption trial and increase citizen surveillance. In Hungary, Hungary has now become the first country in Europe no longer to be classified as a democracy. And that was passed on the back of a need, a justification of fighting the coronavirus. Third, in some contexts, and this is notably true of Modi's India, and the coronavirus has been used as a fillip to kind of further marginalize minorities that we know were already targeted by the Hindu nationalist government. There was a meeting of a large group of Muslims in a mosque, the Tablighi Jamaat, and this mosque, this meeting happened before the lockdown. When the lockdown was announced, the police raided the mosque and tested a number of individuals there. Some of them were shown to test positive for the coronavirus, much like we saw super spreaders in churches in South Korea. But as a result of that, we saw Twitter hashtag Corona Jihad spike in the days afterwards. Over 100 million users on Twitter saw that and were tweeting it. So it's something that we should be very, very concerned about, and I think paying some close attention to. And finally, and this is the last point I'll make, we know that, and this is something I think that Dapo will speak more about, but the right to privacy is something that is being severely limited by governments seeking to tackle the coronavirus. So some of these measures are appropriate in times of unprecedented crisis. But we also know that emergency powers have a way of outliving the emergencies they were intended to address. In the US, for example, presidents have, since the National Emergencies Act of 1976 was passed, over half of the emergencies which have been passed still have powers in place that were justified on the basis of the emergencies that they were intended to address. And I think this is particularly important as we're now in a phase of the coronavirus pandemic, not just in Europe, but worldwide in India. It's being discussed in the United States, where governments are going to be rolling out contact tracing apps, which are going to be collecting a fair bit of information, that one is appropriately scrutinizing what kind of information these apps are collecting. The Arogya Setu, which is now mandatory for all public and private sector employees in India, has already been criticized by some cyber experts as collecting too much information and not having enough safeguards. And the opposition leader has dubbed this app a sophisticated surveillance system. So again, we just have to, I think it's appropriate at this time to have a public conversation about what kind of information needs to be shared in this extraordinary moment, but equally what needs to be done when this moment is over, what kinds of conditions we need to be looking for those kind of extraordinary powers to be handed back in the form of sunset clauses. And this is not just a question for governments, but this is also a question, I think, for universities going forward, which will be undoubtedly collecting some of this information as we attempt to social distance, even as we teach. So thank you.
Thank you so much, Maya. And let us now introduce Federica. Federica is going to take up some of those issues around structural inequalities and develop them further. So Federica, over to you now.
Thank you, Joe, and thank you, Maya, for such a really good, insightful overview that you've provided. And of course, thanks to everybody who's connected and who's watching. So as Joe rightly said, I'm going to be talking about the relationship between coronavirus and structural inequality. And that is because, to be entirely honest, there are far too many areas that are worth scrutinizing when thinking about the relationship between coronavirus and the impact that it's having really on human rights and minority rights. What Maya said, one of the things that Maya said is that coronavirus effects have largely mirrored social inequalities. And I think that is correct. And it's actually worth looking at some data to back this up. So in the United Kingdom, for example, where all minorities make up only 14% of the population, we see that the BA-ME group accounts for 35% of all coronavirus patients in intensive care. Not only that, we also see that around 70% of healthcare professionals that have died of COVID-19 in the UK are from minority groups. And yes, of course, it's true that the NHS, the National Health Service, has a high proportion of people from minority ethnic backgrounds that work there. But it's also true that when we look at respective mortality rates by ethnic backgrounds, the rates really are out of balance. And the UK is not, the United Kingdom is not alone in witnessing these trends. When we look across the metaphorical pond to the United States, we see that even though it's hard to get a complete picture nationwide because data itself is incomplete, when we do look at statistics and figures released by state authorities or other sources, and we start patching together a picture of what that looks like in the US, really the figures are harrowing. So let's take Michigan, for example. There, 15% of the population meets the definition of a minority, yet 40% of deaths occurring due to coronavirus there are being recorded just among African Americans. And we look at Louisiana, for example, which has 32% of African American population, yet 70% of coronavirus deaths are being recorded among that group. And to be honest, this isn't just a matter of north, south, east, west, urban, or rural. When we look at Chicago, for example, which is one of America's wealthiest urban centers, it has practically identical data as Louisiana. And yet, this is not just a problem for countries that have high inequality rates, which one might instinctively be inclined to believe. If you look at Norway, for example, which has a much lower Gini coefficient than both the US and the UK, there the Somali community is experiencing a death rate that is about 10 times higher than of the national average. So there are a few possible causes for this, some of which Maya's touched on. Minority communities, generally speaking, are more likely to be poorer, thus less able maybe to afford healthy foods, have access to healthcare. And in countries like the United States in particular, where healthcare is a privatized commodity. In fact, the United States Surgeon General, Jerome Adams, who is himself an African American, has warned the community that for them, comorbidity is a very serious issue because they have higher rates of underlying conditions linked also to their diet, such as diabetes, heart disease, obesity. Then they're more at risk of dying of the virus. But they're not just more at risk of dying of the virus, they're also more at risk of contracting the virus. And that's because, as Maya was saying, these communities are they're less able to socially distance. So not only they tend to live in smaller, more crowded units where they are also more concentrated in public-facing jobs. Think of transport, delivery, health and social care. So they're at risk of greater exposure. And in fact, it's not by chance that it's in New York City, for example, which quickly became the epicenter of the United States epidemic. The virus there spread among minority and immigrant communities in Queens, which also incidentally recorded some of the highest mortality rates for the entire state. So in my view, it is correct what Maya said, that the effects of coronavirus are mirroring social inequalities, but really I think we should be asking ourselves truly to what extent the virus is contributing to entrenching or maybe exacerbating these inequalities. Let's take the example of work, how these communities have to work, something that Maya also touched upon. So these are communities that more likely than not, or more likely than other communities, have a life of income anxiety because they don't have job security, they don't have savings that they can leverage. Quite often they live paycheck to paycheck. So for them, not going to work, it's not an option because they have to continue to pay rent, they have to continue to put food on their table, they have bills. And in places, again, like the US where healthcare is tied to employment, losing their job also means losing access to healthcare. So absent government action, this creates a perverse incentive, I think, for people in these communities to continue to work as long as they can. And of course, absent widespread testing, this also provides the opportunity for them to do it if they're, for example, asymptomatic or if they have lighter symptoms. So, and because they are in those public-facing jobs, not only they're getting more infected or they're getting infected at higher rates, they're also possibly, quite possibly themselves contributing to spreading the virus. And yes, I know that the US did pass a stimulus bill and also announced that coronavirus treatment for the uninsured would be paid with federal funds, but they didn't do this until April. So there were early weeks in March, which really were missed opportunities, not just for containment itself, but also to make sure that protection were in place for these more vulnerable groups, because as we saw, the two go hand in hand. And this is not a minority specific issue, it's a vulnerability issue, but again, I think it disproportionately impacts minorities. For example, of the 23 million people that lost their jobs in the first 5 weeks of crisis in the US, we see that African Americans lost their jobs at twice the rate as their white American counterparts. And an additional fold in this is the fact that if we insert a gender lens in all of this, really we quite come to appreciate the gravity of the situation and the impact that the pandemic has had on women's life. 85% of nurses, 75% of primary caregivers, 72% of minimum low wage workers, they're women. And lockdown for women, and especially women of color, means that they've had to bear the brunt of the pandemic, not just in terms of job losses, not just in terms of uneven burden sharing, but really also, let's think about, for example, the horrific increase in domestic violence rates. We've seen just in the first 2 weeks of the lockdown in Spain, an increase by 18%, in France by 30%, and reported cases tripling in the Hubei province of China. So the situation truly is dire. And of course, it goes without saying that governments have an obligation to protect these vulnerable communities, but they also have an obligation, much more positive obligation, not to take action that could actually jeopardize the safety of these communities. What do I refer to when I say this? Joe earlier mentioned that some governments are leveraging the pandemic to stroke pre-existing hatred against migrant, refugees, and minorities, such as Roma communities or religious groups. But this isn't just rhetoric. It oftentimes translates into actions, from the curtailing of asylum procedures to harassment, and some communities even being completely cut off from access to services. And something else that really concerns me is the way in which governments are using the pandemic. Some governments are using the pandemic to shove through legislation that actually curtails access to legal and health services, from the tightening of abortion laws in Poland, which has been all over the news recently, is just one example, to the closure of clinics. This pandemic truly has proved itself to be a hand grenade for sexual and reproductive rights. And this is not tangential to today's discussion, because according to the UK Royal College of Obstetricians and Gynecologists, Black women in the UK have 5 times the risk of dying of pregnancy or up to 6 weeks postpartum compared to white women. And in the United States, just this week, the US Center for Disease Control and Prevention said that African-American, Native American, and Alaskan Native women are dying of pregnancy-related causes at a rate about 3 times higher than those of white women. So to conclude, I think that these powerful statistics point to the need by governments to be proactive in trying to understand early on in a crisis, actually trying to anticipate the impact that crises like this will have on vulnerable groups, starting with minorities, but also concerning women and women of color. And in fact, I was glad to read a couple of days ago that Public Health England has announced an inquiry into how ethnicities is affecting vulnerability to coronavirus. So maybe Joe can reconvene us once those results are out and we can discuss them. But I think that understanding the root causes of these patterns is only half the job. I think the other half of the job is for governments to understand that they need strong forward-looking action early on during a pandemic, and not just in terms of course, imposing lockdowns, picking up medical bills, freezing rents where necessary, because this is all very needed and appreciated, but really making sure that there's testing, widespread testing and protective equipment available to those who need to go to work, and also that there is the access to life-saving services is maintained. And I really do believe we should be concerned with the long-term implications of what I raise here, because those that are hit the hardest will also have the hardest time bouncing back. And this means that without a tailored intervention, they will continue to fall further and further behind with respect to the rest of society. So I guess to conclude on a high note, after such presenting such a dire picture, if I were to perhaps look for a silver lining in all this, I would say that I hope that because coronavirus has shined a spotlight on pre-existing structural inequalities, it also will open up the space and will to discuss how to address them, and will translate in not just more awareness, but more sensitivities to the needs of these vulnerable communities. And I think I will stop there.
Thank you so much, Federica. And that's yet another webinar we can have maybe in 2 years' time to see what's happened about the follow-up on the structural inequality. Can I just remind the participants in the meeting, we are going to be posing questions to the panelists. If you'd like to ask a question, can you please write it down in the Q&A that you'll see on your screen. So now let us move to Dapo. Dapo is going to talk about international human rights law and how different countries deal with their human rights obligations. Dapo.
Thank you very much, Joe. As Joe says, I'm going to speak about the application of the international human rights framework in times of crisis, such as the COVID-19 crisis. Recently, the UN Secretary General said that COVID-19 is a human rights crisis, and we might ask ourselves, how is that, or how might that be so? Just to take a step back and to remind ourselves that we have a range of international human rights treaties, and that in thinking about how the law protects minority rights, there's sometimes a tendency, I think, to focus on treaties and legal instruments that are directed particularly at the rights of those minorities and that are directed particularly at vulnerable groups. So for example, we might think of the UN Convention on the Elimination of Racial Discrimination, or we might think about the UN Refugee Convention. However, though I will touch on those particular frameworks, I wish to speak a bit more generally about human rights protection. And this is because, in my view, minority rights are at greatest risk when general human rights protections are weak. It's important to remember that historically, even the general human rights treaties that we now have were drafted because of the experience of the Second World War and the realization of a need for stronger legal frameworks to protect minorities. So we saw the Universal Declaration of Human Rights come straight after the war, which then led to a couple of general international human rights treaties, the most important of which is the International Covenant on Civil and Political Rights. So let me first of all set out how we might start to think about COVID-19 as a human rights crisis in the way that the Secretary General talked about it. So in the fight against the crisis and in the fight against the virus, states are taking a range of measures that restrict rights that people would otherwise enjoy. So just to list a few: freedom of movement, freedom of assembly. So we're all at home, either taking part in this webinar by speaking or by listening. And why is that? That's because, at least in many countries, if not most countries, we're not allowed to go out and exercise the normal freedom of movement that we would have. Freedom of assembly, also restricted. Freedom of expression. So many states have taken measures to, for example, combat fake news, occasionally to prevent criticism of government measures that are taken in the fight against the coronavirus. Maya mentioned earlier on the potential restrictions of privacy rights. So one of the things that seems to be, well, in many cases, it's already the reality, and in some cases, in some states, it's imminently on the horizon, is the use of apps or other technology which will track our movements, with the risk that this technology will be used for more general surveillance and perhaps for controlling movement in other ways. And even more basic rights, the right to life, the freedom from cruel and inhuman treatment, these are also in some senses at risk, at least in some countries at risk at the moment. So in some cases, we've seen countries using using the police to combat protests regarding government measures, leading in some cases to deaths. In fact, in some cases, there were situations where at some point there were more deaths arising from the use of police powers to deal with protests than deaths from the virus itself, or detention cases where people are being locked up for protesting against the measures taken by governments. So these are the dangers that we have to human rights. However, it's important to remember that human rights treaties recognize that many, if not most of the rights that are provided for in those treaties are not absolute. So human rights tries to strike a balance between the protection, or human rights law tries to strike a balance between the protection of human rights and giving states sufficient freedom to combat genuine emergencies or to deal with pressing social needs. So in some cases, these rights, which are not absolute, occasionally have to yield to measures that are taken in times of crisis to combat those pressing social needs. So when we think about freedom of movement, assembly, freedom of speech, privacy rights, the ones that I just mentioned, these are rights that under international law are actually subject to limitations. There are other rights which are not subject to limitations, of course. So the prohibition of torture, the right to life, these are not subject to limitations. But most of the rights that we're dealing with are subject to limitations. And the question is, how do we strike this balance between the protection of the right and the need to tackle this emergency? Now, international law provides two ways in which this balance can be struck. And the challenge is really to think about which of those two ways is best able actually to strike that balance. And the COVID-19 crisis actually gives, it really does give us pause for thought as to how this is best done, because countries are adopting different ways of doing this. So in the first place, these treaties provide that some of these rights, which are not absolute, may be limited by law where they are necessary to achieve certain legitimate objectives, and those objectives are actually set out in the treaties concerned. And these legitimate objectives include the protection of public health. So in principle, it could be lawful for a state and would be lawful for a state to restrict the freedom of movement where this is necessary to protect public health. That's why we're all stuck at home. However, those limitations on the rights are themselves subject to certain limitations. So in the first place, those rights must be limited by law. In other words, there must be a law which provides for the limitation of those rights. Secondly, the limitation of those rights, or the measures that are taken to limit those rights, must be necessary. In other words, they must not go beyond what is necessary to achieve the objectives. And this is where it is really important to think about the scientific evidence and to think about what the evidence actually tells us about the sorts of measures that governments ought to take. So it must be limited by law, number one. Sorry, must be provided by law. The limitation must be provided for by law, number one. The limitation must be necessary, number two. The limitation also must be proportionate. In other words, there must be a certain balance between the measure that is being taken and the legitimate objective which is sought to be achieved. Now, I think one must accept that where the objective that the government is trying to achieve is particularly pressing, and in this case, it might be seen to be so, then the sorts of measures that they may take could be stricter. And finally, and perhaps most importantly in relation to this type of limitation, the measures that are taken must be non-discriminatory. And so it would be unlawful under international human rights law for states to take measures which are directed only at a particular group and which do not affect all other groups as well. But this is only one way in which human rights seeks to achieve this balance between the protection of the right and the pressing social need. And in fact, what I've been talking about is the sort of thing that can actually be done in normal times. So states can adopt, using these tests that I've just set out, they can adopt measures in normal times to restrict some of these rights that I've just talked about. The second way in which rights might be restricted under international law is through something that is known as derogations. So this is a formal sort of statement by the state by which it indicates that it is not able to comply with the rights in time of emergency. So this is specifically related to measures taken in time of emergency. And here the safeguards are, first of all, the state has to declare a state of emergency. Secondly, it has to notify both the existence of the state of the emergency and the measures that it seeks to take to the international community. And then thirdly, again, the measures that are taken must be strictly necessary. And actually, we have seen a whole host of states take these types of derogations across different continents. Mainly, I would say, in Europe, actually mainly Eastern Europe and in Latin America, states have taken these measures. The question that then arises as I round up is, some countries have made these derogations, whereas others have relied on the first type of limitations that I spoke about. And the question is, which of these measures is more protective of rights, and which of these ways of achieving this balance is better able to achieve the balance. On the one hand, one might argue that it is better to have these formal derogations because the state has to consider in advance that it is not able to protect these rights, and then it has to declare that it's not able to do so, and that brings a particular type of scrutiny upon the actions of the state. The downside, of course, to this is, as Maya indicated, many emergency measures tend to outlast the actual emergency. The other downside is that actually there is no restriction with this type of derogation. There's no requirement that that derogation be done by law. So you see in some countries, just the executive declaring a state of emergency and not necessarily having some sort of legislative process. The first type of measure, and this is the last thing that I will say, the first type of limitation where you just have a limitation that's done by law, which is necessary, which is proportionate, that might have the benefit of requiring a degree of public scrutiny. But again, the downside of that type of measure is that it might also outlast the emergency that it's being used for, and it might normalize this restriction on human rights. So let me stop there. Maybe we can pick up some of these in Q&A.
Thank you so much, Dapo. A lot to think about there for governments and for us too. So I hope your questions are coming into the Q&A. I see that a number of them are. And the first one that we will take is a question to all participants from Joshua Castellino. So Joshua asks, my question pertains to the continuing urgent need to design preventative measures that are tailored to minority realities. This means paying particular attention where running water or soap is not available to communities, or social distancing is not possible due to grinding poverty. Can we construct an urgent mechanism where the advice being disseminated is better targeted? As it stands, this advice, which is not even being disseminated evenly, feels hollow to many minority communities. Well, maybe I'll ask Federica to answer that first, or give an answer. So the question is, what can we do, I suppose, or what could we have done to stop some of the inequalities in outcomes developing, and what could we do from now on to try to improve the situation instead of merely analysing it and complaining about it, I suppose. So Federica, over to you first.
Thank you, Joe, and especially thank you to Joshua for asking the question. As a matter of fact, one of the things that I was planning to say, and I didn't, and I'm glad that Joshua was giving me the opportunity, is that when I was talking about understanding the specific ways in which vulnerable communities are affected by the coronavirus, this isn't something that we should just do during crisis. I think that this is something that we should be building at all times. And specifically, I think it goes back to whether lawmakers in most governments have the means to understand and appreciate what living in certain communities and what life in certain communities is like. And in places where we have a very small representation of these communities in government, it's easy to understand why governments wouldn't be able really to grapple with these realities. And so I personally would suggest and would have suggested maybe earlier in this crisis to convene some task forces or working groups that would have a particular lens that would look at how certain communities are living and try and early on in the crisis anticipate what type of targeted measures should have been introduced then.
Okay, so Dapo, is there anything to be said from a human rights perspective about what we could have done and what we should do next to be more protective of minorities?
Yeah, so I think I would make a distinction from a human rights perspective between some of the types of rights that I was talking about, the civil and political rights, and maybe some of the types of rights that Joshua's asking about, the sort of economic and social rights. And I make that distinction simply because the answer is easier in some cases, and I think a lot more difficult in other cases. So with the civil and political rights that I was focusing on, where largely what we're doing is we're asking governments to essentially not to do things which will impact upon the rights of people. I think it's much easier to think about the protection of minority rights there. Much more difficult, I think, in the case of, for example, I think, Joshua's talking about hand washing, right? Where we are asking people to regularly wash their hands. And that seems like so simple, so basic, but actually not so if you don't have access to running water, right? So what can governments do there? It's essentially a resource question, I think. It's essentially, trying to ensure that resources are directed to those communities that are going to find it hardest actually to meet those particular types of, to follow that type of advice.
Okay, I think we'll take the next question, which is a question for Maya, from Vafa, my PhD student, I should declare, interested student here in the school, Vafa Ghazavi. So Vafa asks, have you noticed any positive examples of counter movements, online or offline, where majority communities are standing up for the rights of minorities? For example, are Hindus in India standing up for the rights of Muslim co-citizens? Is there scope for these positive lessons to be better documented and publicized? Maya.
Well, thank you for the question. So I guess I would make a distinction between, there are two examples I can think of. One is pre-coronavirus, where you have seen, in India in particular, a really widespread popular movement that pushed back against some of the movement under the Modi government to rein in the rights of Muslim citizens, particularly the Citizenship Amendment Act. And we saw this widespread protest that sprung copycat movements, the Shaheen Bagh protests. And that was across majority communities standing up for minority communities. Corona specific, I think one of the lesser noticed countries has been actually South Africa. It's a really interesting case that it's among the most, or perhaps the most, unequal country in the world. And it's done an incredibly good job of dealing with a coronavirus, despite kind of low levels of resources. And what I've read suggests that that's partly because South Africa had experienced not just one, but two pandemics in the last 100 years, if you can call HIV a kind of pandemic. So it was particularly hard hit by the 1918 Spanish flu, had the fourth highest mortality rate in the world. And then also had a country that was particularly poorly hit by the HIV outbreak, and of course abetted by poor leadership on the issue. So the current government of South Africa, Ramaphosa, he's acted fast and very, very quickly, and despite having, of course, a history of majority and minority tensions, and time will tell, because of course we're still early stages in the sense that there might well be multiple waves of this, but so far they've done incredibly well at handling this, and that has to do again with a kind of memory of what this can do, and a sense of we-ness, national we-ness, that the leadership has invoked to respond to the pandemic.
Okay, thanks so much. So we'll take the next question. This is from Sareen Shamim. This is a question for Dapo. Sareen says, Dapo, your work mostly focuses on providing humanitarian access to the people in the conflict zones. Unfortunately, in Kashmir, India, we saw the data and the cellular network snapped after an encounter yesterday. Since then, the problems in Kashmir have amplified from reporting any positive case to fetching the basic needs and so on. How do you think we can provide basic human rights in places like these? Not an easy question, Dapo.
No, not an easy question. So I'm not familiar with what happened in Kashmir yesterday, but maybe I might speak generally about the implications of COVID-19 for humanitarian access in conflict zones. I mean, it just actually accentuates the obligations that states ordinarily have to allow and to facilitate humanitarian access in armed conflict. So one of the things that's interesting, I think it was 2 days ago actually, the UN Secretary General wrote to all heads of states, not just in conflict countries, but to all heads of states, asking heads of states to facilitate the work of the World Food Programme in particular and the WHO, particularly in conflict zones, in a number of respects. So, for example, facilitating customs access, so easing restrictions on the importation of humanitarian goods, whether that's PPE or whether that's just food and other basic needs. And also, very often countries deny consent for humanitarian actors to work. And this is a situation where, because of this crisis, that humanitarian work is even more important.
Okay, thank you. So we have a question from Tanya Herforth. It may be slightly outside the scope, but we're going to ask it anyway because it's so important. What are the consequences of the COVID-19 crisis for international cooperation in the health and pandemic preparedness sector? I don't know, perhaps Federica, do you have any thoughts about this question, international cooperation in health and pandemic preparedness sector?
Yes, actually, I do. I guess one of the most disturbing issues that we are seeing, or one of the most disturbing trends that we're seeing, is the lack of international leadership in coordinating an international response to the pandemic. When the Ebola crisis broke out, the UN Security Council came together quite quickly and powerfully mobilized a truly remarkable and very effective response, coordinated response. And this was led by the United States. Instead, the current administration is choosing to not only not leverage the role within the Security Council to mobilize the resources and the powers that the UN would grant them in terms of coordinating a response if the issue were elevated to a matter of international peace and security, but actually they're choosing to withdraw, to slash the funding to the World Health Organization. So I'm really worried about this. And if there was one thing that I would say, and one suggestion, maybe recommendation that I would make, is that those members of the UN Security Council that have those permanent members of the UN Security Council, and specifically perhaps even the United Kingdom government, should reconsider whether there is a role for the UN Security Council here to be played, specifically because already there is a precedent. And I'm aware that this doesn't touch specifically on the issue of preparedness of the sector. Rather, it is a matter about response, but it's something that I'm really concerned about. So sorry if I only answer the question partially.
Okay, thank you so much. So let's move on to the next question. This is from Dr. Antonija Petrakusic, who is a member of the Advisory Committee on the Framework Convention for the Protection of National Minorities in respect of Croatia. And the question is this, and perhaps Maya, this is one for you. A number of Roma children across Europe, as well as children of asylum seekers, refugees, and persons who are granted asylum across Europe, aren't given access to education during lockdown and are unable to participate in online homeschooling due to the inadequacy in official language command. Often they're simply cut off from education, not only because of poor official language command, but also because of lack of parental support and poverty. With a group of scholars and activists in Croatia, I'm fighting these days for the right to education during the COVID-19 pandemic and to eradicate discrimination they're exposed to. What, in your opinion, is the best way to address violation of their right in the arena of international law? So maybe, I said Maya, but perhaps the others would also be interested in this. But Maya, would you like to set us off?
Sure. So with the caveat that, I don't don't know how much this is specific to Roma children in Croatia, but I think more generally, as we think about the ways in which minorities are particularly disproportionately affected by coronavirus, it's also important to understand that the politics of drawing attention to that is often best done through emphasizing commonalities of citizenship. That's in fact how you get things like the NHS first passed, right? You on the backs of this is a moment of coming together. So, there are a couple of specific bits of recommendation I have, which is, one is just to collect this information and to collect data on how Roma children, among other minorities, are disproportionately affected. That data is very important for activism, and then using that data and your understanding of the ways in which particular rights are being violated to develop tailored recommendation. I think this links up with some of the previous questions that have been asked. But in the end, the responses and frankly, the political support for responses to minorities often emphasize that these minorities are citizens too. And I think this links up to some degree with the earlier question about Kashmir. Some of the most effective responses I've seen, not in the recent Kashmir events, but in the events of the last few months, which has seen Kashmiris deprived of their civil liberties, has been to emphasize that Kashmiris are also Indian citizens. And if this kind of thing begins in Kashmir, who knows essentially who's next? So, collecting information, developing tailored recommendations, but also ultimately building political support for universal programs that provide capacity and healthcare systems can tailor and education systems to particularly vulnerable communities in ways that are informed by that data.
Okay, so I'm going to come to Dapo, but there are two other questions that touch on related themes. So I'll raise the other two questions. So Dapo, if you can keep this question about education in mind. The second question, regarding the first way in which the balance that you mentioned before can be struck, would a law that allows for positive discrimination to cater for structural inequalities be in order? So can we deal with structural inequalities through positive discrimination? And the other question, this is from Nicole De Silva. Dapo highlighted the importance of evidence-based limitations on rights. Has any international human rights authority provided specific best practice or standards on gathering rights relevant data during the crisis? Does any state stand out as a particularly good example of evidence-based limitation? So we've got three questions rolled into one. Roma children, minority children, and education, structural inequality and positive discrimination, and finally, examples of best practice. So Dapo, over to you.
Okay, thank you. So let me take two of those questions together. And this is the one about the right to education and the one about positive discrimination to cater for those structural inequalities. And this links back actually to the question that was asked earlier by Joshua about hand washing and things like that. So in thinking about this from a human rights perspective, one of the things that's important to remember is that states do not just have an obligation to not to infringe rights, but states also have obligations to fulfill certain human rights. In other words, it's not just an obligation to not do things, to not interfere with your freedom of movement or your freedom of assembly, but states have a positive duty actually to provide certain things to the extent that they can. And education and some of these structural inequalities that were being referred to earlier fall into that category, where states have these positive duties. Actually, a right of access to healthcare is another thing that one might put into that category. So there, it's not a case of trying to sort of strike a balance. States have an obligation to do whatever they can to provide actually for everyone that resides in their territory. Now, there's no obligation to provide the same thing to everyone because some people might have the thing and others don't have it. it's an obligation to ensure as much as possible that everyone has that access. So I think that's the case for the Roma children in Hungary. And it's also the case in relation to the question about positive discrimination to cater for structural inequalities. In the case of these sorts of positive duties, it's not really a case of positive discrimination. It's just a case of fulfilling the rights of those individuals who don't have that access. Now, Nicole's question about evidence-based limitations on the rights. So first of all, I'm not familiar with whether or not any international human rights authority has provided specific best practices or standards. I suspect that it would be difficult to do because this is very much a case-by-case thing. So what we're saying is that if a state is going to restrict the right of its citizens to freedom of movement, or if it's going to restrict their privacy rights, it must only do it where it is necessary to enact that restriction. Then the question is, when is it necessary? And that's where you need the evidence. So in this particular case, what it means is that you've got to get the right scientific advice. If you're doing things that does not follow the scientific advice, then it may well be the case that you're not doing things that are necessary. And that will vary situation to situation and might even vary country to country.
Okay, well, thank you so much. I'm afraid we're running close to the end now, so my apologies to the more than 20 people who still have questions that we haven't been able to address this point. I'm going to do something, I didn't warn the panelists that I was going to do this, but I'm going to put them all on the spot now. And I'm going to ask each panelist in 30 seconds to tell us the one thing they would like us to take away from this discussion today. So we will start in the order that we started before. So it's particularly unfair to Maya, but Maya, what is the one thing that you would like people to take away from this discussion?
I guess the one thing I'd say is that I'd like us to have conversations now about social inequality and the ways in which social inequality is being amplified, and not just reflected, as I said, but amplified by the crisis. And to also simultaneously have a conversation about the right balance, not just now, but going forward, what the right balance will be between restrictions on civil liberties. As Dapo said, we're all sitting here in our homes or various corners of the world because governments have decided that we cannot leave our homes for work. That is appropriate, I think many of us feel now, but there will become a time when that's no longer appropriate. And I'd encourage us to have a national conversation in each of our countries about what that time will be.
Fantastic, thank you. Federica, you know what to do.
I actually join Maya in the two suggestions and the two takeaways that she has put forward. And I guess the third one that I would pile on top of those two is to really look beyond our national context and really have a think in terms of what this pandemic means for international diplomacy, for the international order, for international cooperation, because what we're seeing is an enormous pressure on international organizations and international institutions that were already perhaps not doing too well on their own, because maybe they had structural flaws or other types of problems. And maybe my appeal is at this moment that rather than withdraw from these institutions and use them to scapegoat what's been sometimes a wanting response, that we actually rally with them and we try and support them as much as possible, because I think that a pandemic teaches is that no nation can address this type of issues alone, and so we really need to rely on multilateralism.
Fantastic. And Dapo, we're running very short of time now, so just a quick word from you.
Yeah, so one word from me, it would be vigilance. It really is about vigilance in protecting our rights. And the reason why you know, in the limitations that I spoke about, the reason why these treaties say that they must be done by law is to promote that conversation that Maya was talking about. In other words, to say that you really need, through politics of some sort, to be vigilant in relation to what you're doing. Second thing that I would say, when Maya says we should have the conversation now and later, structurally, the best way to ensure that is that all of these laws that are being passed should, in principle, have sunset clauses. In other words, they will automatically terminate unless they are renewed. That forces us to actually have that conversation later on.
Well, thank you so much. So thank you to all panelists and to the participants. And for those of you who asked questions that we were unable to answer, my apologies to you. But I hope that if you did enjoy this event, you'll keep an eye on the school website, the Blavatnik School of Government website, for future events and other information. And if you're working in policy and want to engage with our thinking in depth, you might want to consider our new Evidence in Public Policy course, an 8-week online program. This course, taught by Blavatnik School faculty, will give you the tools to base policy on evidence, which I think we can agree has never been more important. So my thanks to everyone who participated today, everyone who made it possible, and I hope you all have, well, a good evening in Europe and a good whatever part of the day is coming up the rest for people in the rest of the world. Thank you very much.